World Doc Alan podcast. I'm excited to welcome to the program, World Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic is pregnant and afraid. You just discovered you're pregnant. Now what?
Well, pregnancy can occur to a 12-year-old, 24-year-old, or a 48-year-old. And there's going to be different questions depending on how old you are. But the other problem with pregnancy is sometimes it's planned and sometimes it's not planned. So, if you're 17 and pregnant and in high school and wondering what to do, what should you do? Well, probably if you have a parent you can trust, that would be the first thing you should do. But just because you don't expect the pregnancy or anticipate it doesn't mean it can't be a good pregnancy. Years ago, we would find a 16-year-old and a 20-year-old teacher, and there'd be pregnancy, and they'd get married, and they'd live happily ever after. Whereas now, today, the man would be in prison for 25 years. But anyway, pregnant and afraid. There's a lot of reasons, but you could work through the reasons, and for the most part, come out happy with it.
Who am I to be asking questions of any doctor?
Well, there is a tremendous differential in power. Of course, the doctor has the power and the patient doesn't have the power. So a lot of people are just intimidated by getting to see a doctor or getting into the doctor's office. But don't be intimidated. You have a right to know what's going to happen to you. You have a right to ask any question at all from your doctor, and you have a right to get an answer.
How many babies has your doctor delivered?
Well, it depends on. There are doctors who've delivered 100 babies, and there are doctors who've delivered 1,000 babies. So, if you've got a doctor who's delivered 1,000 babies, there's probably a little bit more expertise than somebody who's delivered 100. So try to figure out how many deliveries your doctor has done. And also, any problems, your doctor's probably not going to tell you how many maternal deaths he's had, even if you ask. But you can get an answer to how many cesareans have you done and what's your cesarean rate at your hospital.
Will the doctor you are visiting with be delivering your baby?
Well, that's a good question, because sometimes, the average patient is going to see an obstetrician who's part of a group. There may be 6, 7, or 8 in the group. So you have a really good reason to ask the question, will you be at my delivery? And chances are, the way things run today, that might be just by chance.
Who will see me when I come in for regular scheduled prenatal visits?
Well, that's a good question. Again, if you have a group that's 5, 6, 7, or 8 people, sometimes they like to just rotate through so that the average patient will have some idea of who it is they're going to see. On the other hand, that does not promote a good patient-provider relationship, which I think is the key or the hallmark of a healthy pregnancy outcome.
Can I steer my pregnancy?
You sure can, and nobody can steer it better than mom, and with dad's help. Take charge of your pregnancy, take charge of your visits, and you'll feel more comfortable when it comes to actually getting in and making that delivery.
All right, the best place to go is royaldocallen.com, royaldocallenpodcast.com, and safepregnancies.foundation.com. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast, guys. Take care.